Hi, everyone. Welcome to the Harmony Foundation podcast series. I'm pleased today to be joined with Nadine Kelleher, John Glendenning, Jessica Albusen, all with Boulder Integrated Health. Welcome.
Thank you.
Thank you. It's good to have you all here today. We're interested in hearing about Boulder Integrated Health and the resources that you're going to be providing down in the Boulder, Colorado area. But before we do that, we want to learn a little bit about your backgrounds. And so let's start with you first, Nadine. So you're a recent transplant to Colorado from California.
I am.
And so what got you interested in doing this project?
Well, I've always been interested in addiction medicine. I'm trained as an adult geriatric nurse practitioner. And back when I was in college, I took a chemical dependency certification program at UCSD. And since then, I haven't really delved into this area, so I'm new to the industry, but really looking forward to helping people get off drugs.
Well, and of course, you know several people in the Boulder area that are already working with addiction, and so I'm sure having those connections really helps too.
Yes,
That's
absolutely.
Great. How about you, John? You're not a first timer in Colorado, but you're back from the East Coast, right?
Yeah, so I have a background as a founder of multiple companies, and I have a friend that has been working in the industry for a long time, and we've been talking about starting something for years. And you know, what really got me interested in this is I've had about 25 friends overdose and die from heroin addiction specifically. So this is close to my heart, trying to solve this problem and help alleviate it, especially as the opioid epidemic continues to proliferate and get worse. So I'm excited to be here and working on the, sort of the boring business side of this, but making sure that we can continue to help the patients that come to us.
The very important as well side of the business world. So, and Dr. Albusen, tell us a little bit about your background.
Yeah, so I'm an internal medicine trained doctor, but interestingly, before I went into internal medicine as a residency, I did a year of psychiatry. So I got exposed a lot to addiction at that time. Actually got to do some rotations at inpatient detox units. But this will be my first, working outside of the straight medical, type program. Right now I'm a hospitalist at Boulder Community Hospital, where we do deal with a lot of inpatient, acutely detoxing patients. But similar to John, I do have a lot of kind of personal family and friends that have gone through. Yeah. So definitely matters to me personally. Yeah.
Well, it's wonderful to have you engaged from a almost a med surgical side, being a hospitalist, working in the behavioral health side, and seeing, because people always used to say that hospitals don't want to touch addiction, particularly in the ERs, but they have to. They have to be aware of it, but they don't necessarily understand the full scope of it. So
I think what we do in the hospital is very one-sided. It's really, it's like keeping people alive as they get through withdrawal, which is what's going to be really interesting, with this program is not just taking that piece on, but taking on the whole patient and really working through what's behind their addiction and how to get them through to the next phase as well.
So I'm certain that you and Nadine are going to be working very closely together from the medical side. So can you both talk with me a little bit about the vision of how this program is going to be for Boulder and for the Colorado community in particular in regards to sort of the acute nature of addressing addiction? So we're looking at med detox specifically for this program? Okay. So how would that look?
Well, I think right now there's a gap and for a lot of patients in that piece. Patients do often end up trying to get through acute detox either at home on their own or end up being transferred over to a hospital because they're too sick for a facility like the ARC or something that does sort of acute detox on a lower level. But this would be bridging that gap to allow patients to have higher level of care in terms of an inpatient sort of medical detox that then can take them from that phase into the next phase of recovery.
And then stepping them into another program that might help them. So your program's really, Nadine, you think it's really going to be more short term?
Yes, we're actually we're pre-treatment. So we're going to get the patients off the meds or drugs that they're on. And our name Integrated, we're actually having looking at the whole patient, and we're offering AccuDetox, which is acupuncture, and it's in the ear, and they've had great success with not only decreasing cravings, but actually insomnia, anxiety, all kinds of improvement in the patient. So we're going to offer that as well as nutrition. People that are up to it, we have trails right outside of our facility, and we have a yoga instructor that's offered to come. So we're really looking at the whole person, and that's where Integrated comes from. We're
That's
doing
fantastic.
East and West medicine.
Wonderful. And I've heard great things about the auricular acupuncture. We actually do a version of acupuncture here for our detox clients as well, and we've seen great research on the value of it, like, particularly on sleep hygiene and really helping with that. So, and I think more and more programs really need to integrate both the East and the West, because it can't just be one or nothing at all. So
That's what we believe.
That's fantastic. So, John, we're here at Harmony Foundation. We're going to talk about harmony. So what does that mean to you when you think of harmony?
Well, I've known about harmony for a long time, and quite simply, it represents the best care in Colorado. I've known a number of people that have come here. I've recommended people to come here, and harmony is it's the best. What can I say? It represents, it's a very spiritual place. It's nestled up here in Estes Park, and I don't know what else to say.
Well, thank you for that. That's great. That's great to hear. And we're really excited about working with you all and looking forward to the opportunities that you all will be able to provide to families and individuals who are struggling with this disease. And so, more to come in regards to the program and where it's headed. And so thanks for visiting with us, and we look forward to working with you.
Great. Thanks for having us.